John, we can't do this without good connectivity and being able to stitch all this together, telemedicine, et cetera. Where does Verizon public sector fit into an ecosystem like this?
Yeah, thanks again, Luke, for having me. And I think it's a great question. You know, today's environment has put a lot of resiliency and dependency on remote networks. And so, as Verizon, I think we're excited and eager to participate and help to fuel the telehealth and interoperability that some of the folks you've heard talk already have mentioned. So, you know, we're doing a lot of work to expand 5G. I'm sure you've been reading a lot about that recently, but, you know, finding ways to provide additional bandwidth, lower latency, and really push new and innovative use cases to our end users. You know, Verizon, we're obviously, you know, concerned today about caring for our employees and certainly, you know, caring for their safety, but then finding ways to leverage technology to innovate and fuel telehealth and keep people maybe out of large healthcare facilities if they need to be isolated and need to be in a safer environment is critical. So recently we just launched our 5G mobile edge compute platform. It's a partnership with AWS. It's called Wavelength. And so finding ways to push compute power to the edge, higher powered you know, applications that can now be delivered outside of a heavy data center can really help enable, you know, remote solutions. I wanted to call out Shaminder and his team at the VA. You know, we've been working a lot with folks at Palo Alto on a 5G pilot, where we have partners like Metavis who have been working to really discover and innovate how we can leverage something like 5G to provide better care for patients. So imagine, you know, a world where instead of looking, you know, a doctor looking at a 2D sort of MRI, you know, image on a screen and then trying to turn to a patient and enable or you know, translate that in their mind, you know, where is the issue? What's happening with this patient? Now we can potentially have a VR or AR situation where the doctor can look at the patient and lay the MRI image right on top of the patient and be much more accurate in how we deliver care and services. So, you know, some really innovative stuff that's happening, some really, you know, I think exciting things that Verizon can do to help enable a lot of these services at the edge. And that's sort of on the, you know, the cutting edge. We're also doing things just sort of day to day by enabling, you know, mobile EHR access and you know, providing, as Jose mentioned, you know, access to applications when people are up and down I-95 and delivering that information in a secure and reliable way. Is critical. So this has presented a lot of new challenges and a lot of new opportunities, and we're excited to leverage the Verizon network and help to deliver for our partners and their missions.